Welcome to the Depressy podcast.
I'm Missy.
And I'm Allie.
And we're sisters
in the mental health field.
Talking about all things stressy
and depressy. Oh my gosh.
Okay,
Wowza.
We're coming at you. Well, first disclaimer, we are not professionals in our field yet. This podcast is not meant to be mental health or health advice. So just listen to us gab and take it for that. Now to launch into probably what's at the forefront of your mind possibly is that this audio quality, again, is not probably your favorite. So if you're still here with us, we appreciate you. We're going through some troubles here.
I think maybe I'll try to get the microphone either when I come visit you or I'll figure it out. Because I have to go home to get the invitations anyway. Wedding invitations are supposed to be delivered today.
Oh my gosh. I was just thinking about that.
I will say it's so funny because bridal shower invitations went out a while ago and the RSVP was due a couple days ago, and my Aunt Sue is very graciously hosting it, and she was like, sent us this long list of people who had not RSVP'd, and it was equal representation from both sides of the family, but like a strong long list, like maybe like a third of the people.
I know that happened to me too, where I was like, come on, people.
Hello?
Isn't this the priority of your year? Come on.
Yeah, no, literally. Now I'm like an RSVP like right away to people's things. Like, I'm a different girl. I see the other side. But people that you wouldn't expect to not RSVP, like,
yeah, it is always
uncles, like people who are like adults who you like consider to be very like on top of stuff. I'm like, huh, interesting.
And it was one thing back in the day when it was like you had to mail in, and some people still do this for the weddings where you have to like mail that in. That to me is like, I get that's kind of like you have to find a time to go do that. But if it's just like a text or an email or an online RSVP, like, I don't understand. I do that right away. I get the invite. I'm like, can I go or can I not?
Yeah.
That's it.
I try to do it right away now. Especially because I'm terrified of forgetting for the actual wedding or I guess also bridal showers. Right. But to do the registry gifts right away because I will forget. Like, I'm like, did I send them something?
I know.
We actually did forget to do it once, and we sent it like 2 weeks after the wedding. But
I actually think that's fine. Having had a wedding, like especially now with the registries being like they ship the gift to you, it's not like it's a physical gift. I just
donated to the funds.
Yeah, or that. We totally appreciate it. I feel like that's happened to us like it happened to us once that was like on the wedding day and we had forgotten. We were like, oh no, we need to send them the gift now. And like we were so bent out of shape about it. And now having had a wedding, I'm like, oh, like I don't even like there. I feel like I was doing wedding and obviously it's nice that you get the bulk of things before because then you can after your wedding day be like excited about these things. But it's not like we opened all our gifts right away. Like I don't know. I think. And I wasn't really checking for exactly when things had been sent. And it was very sweet. Even we had people send it. We had a few people even send it like months after who forgot.
Yeah.
And like I still thought that was a very sweet gesture. I get things happen.
I feel like my fear is always like they have already written the thank you notes. So at that point, they're looking and being like, oh, this person didn't give a gift. Like, right. So I want to do it before they notice. Few people,
but like, again, it truly was no hard feelings. It's a really interesting thing when you're on the other side of it. At least for us, we found it was some obviously overall, I think correlated to like, you know, people who were like older generation gave us more generally, right? That makes sense than like people our age. But still in terms of people who gave versus didn't, there was really no relationship to like
I mean whatever like always gifts are just like whatever people can give, and you're 100%. Obviously most thankful we definitely for like had people's presents, like not presents but presents with a C, right, or an S. What is presents?
And presents with us. Well, there's both an S and a C.
Okay, not a T.
Yeah,
presents.
People
like they are at
being
the
there
wedding.
Physically present.
Yes, that is obviously. But it's funny. There's people who I'm like, I don't want you there, and you don't give gifts. So There's
Sure.
no redeeming quality there.
Yeah. Yeah, I know. It's interesting being on I think people have different situations, also like different phases of life of like if you're invited to many, many weddings in a given year, like you might have to budget differently than if you're like, oh, I'm attending only a few. And so many factors I think go into it. So I think being on our end, like, yeah, there were absolutely cases where it's like people like, again, it's relative to what they make and what they can give. And we were extremely grateful for any amount of gift, like truly, even if it was like a much smaller gift, because those tended to be folks who like maybe were in grad school or like not.
Yeah.
You
no,
know,
of
like
course.
it really, yeah. So,
I do not even expect, I'm like, I would be okay with a couple people that we've invited, especially like med school friends or people who like do not have a lot of money. Like, I do not need a gift from you. I mean, obviously, I think like
any kind of gesture from those people
gesture
was extremely appreciated. Honestly, the amount for us was not something we read into at all. Like, we were just so grateful to get from whoever. It was more just interesting when we learned, oh, wow, okay.
No,
like,
it is
you don't know how much other people are giving before you go through it.
I think it's been interesting, too, because people are buying expensive things off my registry. And I had only put kind of like a couple of expensive things. And there's a couple people who, like, I expected, like, are very close to me and, like, you know, I, like, you know, for example, know that they gave you a nice gift. But people, like, who I didn't expect, like,
yeah,
are giving very generous gifts. And I'm like, oh, man, we either have to add more to the registry.
Yeah.
Or I'm just like, you can also just
do you have just like, because I was looking at your registry and you have a bunch of different funds for like specific things, but do you have like
I do
like,
have a big
open
honeymoon fund. Yeah, I do.
Okay.
And
because I was looking and I was like, I can see the logic behind that. Like, oh, buy us a nice meal, buy us this excursion. But sometimes people want to give the amount that they typically give. Like, I don't know.
I agree. I do just have a general fund. I also have like a general down payment on a future home fund. So you can give to like whatever you want. But no, that was a strategy because truly like we do not need for a lot of stuff. We did end up registering for like plates and, you know, like, you know, dinnerware and that kind of stuff and like forks and knives and all of that. But like, I don't know. There's a lot of things that I feel like people register for that we didn't. And I do feel like are kind of keeping our list like smaller than maybe other people.
I would say it's okay. Like
but I'm fine
if
because
there's things
I'm
you
like,
don't need
money.
Yeah, I would say if there's like, it doesn't make sense to get a gift that you truly may not use. Like,
and I will say everything
nice.
on the registry is something that we actually do want. So those gifts are very
that's
appreciated.
Like a good place to
that's
be
not
in
saying that, oh, if you gave me the actual gift on the registry, I'm appreciating that less than money. But I'm like,
once you get
the
past
things we want, and once you get past that, please just put it into funds so that we can use it for like the future. Like when we're starting a family or like moving costs, like things like that.
I know. I feel like for when thinking about the registry, yeah, people do it all so differently. And sometimes I look at people's registries now and I'm like, oh, that's an interesting, like I wouldn't have thought to put this kind of thing, but like that's a great use of it. But I would say there's not a perfect how much or how little. Some people are going to want to register for a lot more. And part of that is also just like phase of life. But I feel like the sweet spot is where you feel like, okay, like these are all things that we would ultimately want. Maybe there are things that like we wouldn't feel that we would spring for ourselves, but like we're just so grateful to get as a gift. But once you reach a point where you're like, anything more would just be to like appease people, like that doesn't do anyone any good, right?
We actually had this random relative, I won't even say what side of the family, like let's keep it vague. I do not think they listen to this podcast, but you never know, who like commented and was like, this was like a while ago, like this summer, before we had sent out save the dates or even like engagement dinner stuff. So like our wedding website isn't even searchable. Like you can't search it.
Discovered it.
They discovered it. Or I'm like trying to think, I'm like, did I send it to someone and they asked for it? Like I do not know how it got to them, but then they were talking, like, through the grapevine. This got back to me that this person was, like, checking our website frequently and was annoyed that we hadn't added a lot to our registry. And I'm like, girlfriend.
Sorry, you're annoyed.
I was like, you do not need to be
like, not yet.
looking
okay. That's so kind that they're
website
really chomping at the bit to get
I think
you a
I
gift.
took it the wrong way. I think they were excited to give a gift and we're not. Like, of course, let me take it the right way. Is like someone is so excited for our wedding that they are looking at our wedding website. But I was very stressed at the time because I was like, okay, we need to send out engagement dinner invites. We need to send out like the save the dates. Like, it was definitely getting to that point. Like, okay, like actually needing to like move things forward. Like, now it's actually time to, like, the bridesmaids dresses fiasco was going on at that time, making sure my dress, and then this person is like, why don't you have enough stuff on your wedding website? I'm like, girl, not right now. Not right now. But, obviously I am very thankful that I have people in my life that are excited.
Exactly.
I know. So, like, reframe. Like, I took it the wrong way at the time, but I will say another thing that's random that I thought about is that I do not give gifts if mom and dad are invited.
Well, we're in I think which we talk to them about. Like, it's not like we just decide not to give gifts.
No,
like,
and they like
as a family
say it like that they're giving as a family. I mean, I think maybe once we're even when, I guess, I'm not sure, because once we're married, like, we'll actually, not just because we're married, but because I will now have an income, and even, let's say, like, the average residency income is like around $70K, like, starting.
Sure.
We're currently living off of $30K for Lucas's, like, stipend for his grad school program. So, like, we will feel rich. It is a good amount of money, but, like, of course, it's not actually, we're not,
right.
like,
You're not making
rolling in
as
it.
A doctor.
Yes.
And, like, what many people who are
still,
our age who have higher
and we're gonna want to
make.
save and, like, all that good stuff, like, all that stuff. But I'm like, okay, maybe I will feel differently when I'm actually, like, making an income. But genuinely, I'm like, okay, if mom and dad are invited, then they will pay for our family. But I remember you being like, I don't know when I realized, I think it was, like, you were talking about how you and Jacob's sister, like, you guys got married, like, the same year, very close together.
Oh,
I forget.
yeah. We
you
got
just
married 3 months apart.
you just decided not to give each other gifts. And I don't think that really, like, I didn't, like, understand that. I was just like, oh, yeah, that makes sense. And then I, like, was processing that later, and I was like, wait, was I supposed to give you a gift for your wedding? I didn't even consider that. I'm like, I'm family. Like, I don't know how to describe it. I'm like, what am I giving you? Like, I'm giving you my presents.
It is different that Jacob's siblings, he's the 3rd out of 4. So, in general, they're older. They all have, like, pretty well-paying jobs. Like, they all make more money than we do. To
be fair, I gave you little tchotchkes.
You did give me gifts. No, and that's what I mean. That's what I mean when I say you did give me gifts. You did not give me, like, a check, but okay.
That was more just like, oh, this is fun. Like, the way I do it for, like, a friend's birthday. Like, I wasn't in the wedding mindset of, like, actually giving you a gift. And, like, anytime we go to, like, a family thing, like, our cousin got married, like, I didn't even think about it. So now then I was reflecting, and I would have gone about this different now at this point in my life, but when I was the maid of honor for my really good friend, I did not give a gift. And I did give a gift for her bridal shower, but when mom and dad were giving, I was under the assumption, and I know mom and dad were also giving as, like, them and us, but I don't know if that, like, clocked in, you know, my friend's mind, or if she thinks I didn't give a gift. So I genuinely need to, like, talk to her about that, but I don't know if that's, like, awkward where she doesn't even remember or what. So I do think about that, and I'm like,
I think you can broach it with her. I actually think you can. Not
I'm
like
just gonna, like,
salty person, but I remember that I don't remember the amounts that people gave. If people gave, and it was, like, so sweet. If people did not give a gift, I remember. Like,
okay.
And that's not because, but I did think of, like, if a family gave, that tended to register for me, like, that.
No, yeah. And I'm trying to think of, like, even people that I know are working, like, like one of our cousins who has like the
Yeah.
two girls, I do not expect. One of them's like still in college. One of them's
Yeah,
like,
and that's how I felt about
new
you
grad.
guys, you and Alex. Like I felt
wouldn't
like I
even
was like,
clock
you two are
that.
still in school. Like your money is coming, like you don't have disposable income. Like any gesture that, and this is how I felt about friends too, who are in med school or grad school who really don't have an income. Like if they gave me anything that was just a gesture, that was extremely kind to me. And
But
I
did
took
you think
that,
about it at all as like, oh, Allie didn't give me a gift?
no, I think like, well, I guess
be
like in the
honest,
sense that we always gave to Jacob's, well, I guess always we gave to Jacob's brother who got married. At the time that he got married, it was at a point where we made, I'm trying to think exactly at that time, but like we probably made less than, or about like almost like half of what we do now, maybe a little more than that. So like we really did not have much income, but like we did give to, we made more than you guys because Jacob had like more of like a full-time job, but like my stipend was a lot lower than it is now, and Jacob was just like lower down in his like earning potential at the time. And so we still gave, and we like coordinated with his other siblings who like make a lot more money than we do. So we wanted to all give the same amount, which we did. But I feel like just because that was their family dynamic where like we're kind of the only ones who like don't make as much, but on my side in our family,
you're the rich ones.
I'm the Alex is about to be.
I know,
but I feel like because he has a real big boy job
he's
starting by the time this comes out. But before he was in school, you were in school.
But
like,
I
it was just
still
totally
wouldn't
vibe.
expect a gift from Alex.
Well, that's just because he's a youngest boy and not.
I wouldn't expect a gift from you.
Oh, well, we'll definitely give you a gift. But
really? You do not have to. Like,
But it feels weird that we would do that for like Jacob's sister and not you.
But I really need to be nicer to you. Is what I'm feeling.
I think we should go into Stressy Depressy because we have some stuff to catch up on.
Okay, what's yours?
Mine is that it hasn't even been that long. It has been in the Depressy universe. Like you haven't heard from us in a couple weeks. And the reason for that is because your girl has been sick again. She literally just got up enough to take a big heaping breath in last time. She was like, I'm finally not sick again. Bam. She fell right back down. The universe just put her right in her place. So yeah, I just got like a fever last week. I've been coughing all week. You might still hear it a little bit in my voice, and I've muted a couple times to cough. I'm not coughing as much today. Knock on wood. However, just as that cough is going the way, the universe is like, she needs to be put in some kind of place. I don't know. But my period cramps are the worst that they've maybe ever been. Wow. I was telling Allie I was doing my makeup for Depressy and I had to pause every like 2 minutes because I was like doubling over in pain. So then I took Advil, and that's how I'm here with you today because I'm currently sponsored by Advil.
I'm currently sponsored by Tylenol.
Yeah. So that's how I'm doing. And just like last time, this is literally my Stressy Depressy from last episode that I was so sick and I had to be doing interviews. Guess what I was doing again this week? So sick doing interviews. I will say that the positive reframe was that the time that I was the sickest was actually the one window of time I didn't have any interviews. So it was like I didn't interview like the Friday before I got sick. Saturday night started to feel really not good. Sunday, horrible, fever. Monday, recovering. Not until Thursday did I have another interview. So I really had some solid time when I was like my sickest where I could truly sign off. However, I did have other work to do that didn't get done as much, and it's like tough with all these interviews, whatever. But at least by the time the interviews restarted, I was like able to like I wasn't having a fever anymore and I could like be present all day for that. But it has just been, I am so ready for this winter to be over. I'm like, it is probably why I'm falling sick so much is I'm like stressed about matching, and it's like just such an intense time, and I'm getting sick left and right. My period's going wacko. I don't even know. I am not good right now.
It's so interesting because, well, I was actually talking to my really good friend. I'll just say her name, Reham. And my anxiety has been pretty bad. I would actually say worse than it's been since I applied to residency.
Yeah.
Like after I submitted application to residency, my anxiety fell so much. Like, and I'm still doing stuff. I was on my IM rotation. I was interviewing. Was like stressed about getting interviews, but like I just feel like I kept a very, very good balance in my life. I was training for my half marathon. Like I felt physically really strong and capable. I was like really taking good care of myself. And then I hurt my knee. And I can't remember if I talked about this last time, but womp womp, I hurt my knee. I can't run. Haven't been really doing any kind of other exercise because when I try, that also hurts my knee. I could swim. I don't want to swim. The barrier to like actually doing that has been really tough. So in my brain, I've just decided, okay, I got my MRI of my knee on Friday. Today's Monday. So I'm like, it's supposed to come back this week. If it says nothing's wrong, then I'll just like figure out like PT or something and I'll go back to exercise. If it says something's wrong, then I'll continue to wait before I like go back to exercise. Highest on the differential right now is an MCL tear, just because the exact location of my knee pain is like where MCL attaches. But that like just doesn't feel right to me. Like I actually feel like nothing's wrong, and it's like it's just something intangible is like wrong with my knee, because I feel like almost never, and this actually kind of goes into what we're going to talk about today, almost never when I think something's wrong with me is there actually like a definitive test that like shows up positive. So I am just not expecting positive. And I will say, like, sometimes I can fall into this trap too, like truly, and I understand patients when they get this way, is that when you get a negative result, it feels like super disheartening, because even though it's a good thing that, for example, you don't tear your MCL or don't have celiac disease or don't have blah, 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 blah. Right. But because in some ways it feels invalidating, because that felt like, oh, but that explains my pain. So, like, actually now I feel like I'm not being taken seriously, or I don't have a reason for this, like, yada, yada, yada. So anyway, I'm waiting for this. And then on top of this, like, the nebulous stress, I feel like during interview season, I had something to do that was, like, tangible to move myself forward towards the matching process. Right now, it is truly just a wait. And I remember how stressed I was for med school when I got to that point. And then another thing that's going on, we're obviously getting closer to the wedding. There's a lot now of just, like, decision fatigue. I do feel like I was kind of like really naive and whatever about saying, oh, planning a wedding is not that stressful. And it's not that stressful for me in the beginning. We are now in the last 3 months. Yeah. It truly is. We're less than 90 days. We're 82 days away. I have a little countdown downstairs. It used to be so exciting as I was flipping the numbers to get lower and lower. And it's like, oh my God, only 82 days away. We have to plan the honeymoon. And not just the honeymoon, like, okay, flights are booked, but like, okay, where are we going to eat? Like, we're going to Japan, spoiler alert. But Japan's a place where you need reservations for food. Like, oh my gosh. So that's overwhelming. But, like, again, like, I have a lot of time, so, like, why aren't I devoting my time to doing that? Because I don't know. And then the other thing that stressed me out is that my cat's tooth broke. Did you even know about this? Because I called Jacob.
Did. Oh, I know about it. I know about Cassie's tooth.
Who told you about Cassie's tooth?
Everyone. I was in Florida with the family, and
oh my God.
Everyone was...
Basically, Cassie's, my cat, big, like, canine tooth. Like, you know how cats, like, have, like, the two fangs, or, like, whatever. Yeah. One of them is like, has like a dull bottom. It basically looks like instead of like going to a point, it goes to like like a flat. And so like you can tell like when you compare, it doesn't necessarily look so much shorter. So like you don't look until the vet pointed out, which I feel awful about. I did not notice that. Oh yeah, it doesn't have the little point at the bottom, like that chipped off.
Yeah.
And apparently now I know this, that cats' nerves in their tooth go all the way down to the tip of the tooth. So when that falls off or that is broken, it's actually like serious, because not only is their root exposed, like it's very painful, and it can get like infected. So anyway, she has to get surgery February 6th.
That's the day my rankings are due.
Wow, big day.
It'll be a big day for me and Cassie.
I've been babysitting a ton, which actually has been good for my mental health, because just getting out of the house and like having something to do. Although I'm very content staying home, I do think just like in an anxiety way, it's been nice to like make money and like feel useful and do something that I do enjoy most of the time.
It's like our episode on like do it depressed, like just
do
not
it
that you're
anxious.
Depressed, but just like
I'm
even
anxious.
if I think it applies to being anxious too. Like your instinct might be to avoid, but actually to like not necessarily brute force your way through things, but like intentional having a schedule doing things can actually be really beneficial.
Yeah. So anyway, I'm like I actually was talking to Reham about this, and one of my like really good friends, who has a little girl who is so cute. Missy and I are going to visit her. So excited. And I was like, I'm kind of annoyed at myself, because why am I stressed now? Like literally, like, yeah, I just feel like frustrated with myself. And she was like, well, you're having like a lot of transitions in your life. Like even like that is stressful.
Yeah.
And I was like, whoa. And she was like, no, I feel like, you know, when I was like having her baby, like she was like off from work for like the week before or something. And she was like, I was very stressed.
Yeah.
And then like during maternity leave, like there's times, even if you have more time, which I feel like, oh, isn't it when I don't have time to do things that I'm stressed? I think that's like part of it. But it's really just like how much control you feel over your life.
Yes.
And there is such a lack of control in my life right now. Like, I do not know where I'm going for residency. There's a lot of things up in the air for the wedding that like we need to get figured out. And I feel like I'm like just in this space of like not knowing what's coming next.
No, totally. No, I feel that too. I feel like I've definitely been a little more on edge, and I'm someone who fully like I knew this the first time when I submitted my applications. Like I would say that doing the applications was stressful. My anxiety though really spiked once I submitted. Like I was having intrusive thoughts like, did I actually submit? Did I accidentally not submit certain things? Did I even like I had thoughts about like, did I accidentally include identifying patient information in my materials? Like things that I knew I had checked a million times and didn't do. I could not like shake these anxiety feelings because I couldn't do anything. I had no control anymore. Like it was off in the ether. And that anxiety really didn't start to go down until I even getting one interview invite where I was like, oh, okay, this means that like I did submit my applications properly and I didn't include anything crazy in them. And like just getting like any feedback, I was like, thank God, like something has worked. And I feel like the interview process has been same. Like it's been stressful, but I think now that the interview process is like really almost at a close for me is when my anxiety is starting to spike. And I'm like, how will I get through the next month before match? Like I have no idea. I just need it to be over. And I've been a little bit more on edge about things that seemingly are unrelated. And I feel like my husband, Jacob, has been like, I think you're just like really anxious about what is gonna happen. Like this is a big moment for you, you know? Like I've been getting headaches too, like probably migraines, just because I'm like light and noise sensitive, like which is like some of the more hallmarks of. But I am also wondering, I will out myself, but I'm not even embarrassed about this, I'm playing Animal Crossing hours a day. Like, well, actually, I don't know, because when I'm nannying, like, it feels like a lot, but it's, like, every time they're asleep. So it takes, like, probably 2 hours a day. And then I come home and play some, so, I don't know, 4 hours a day. That is hours, so whatever. That's a significant chunk of time. And I think that is very much contributing to my headaches. And something that I don't buy into, which, for no reason other than personal gut feeling, again, like, that's not a good guiding light, but, I am like, blue light is fake. But then I was honestly looking up like, okay, I'm getting headaches like being on my Switch.
like playing Animal Crossing, and people were like, oh, it went away for me once I wore my blue light glasses. And I was like, ooh, my new glasses are not blue light, because in my brain I was like, oh, if I'm ever on my computer just doing that activity, I'll just wear my reading glasses, so maybe I'll do that. We'll see.
Yeah. I will say maybe it's placebo, who's to say, but I did have a period where I was more prone to headaches, and it's really gone away getting blue light glasses and being more intentional about like taking breaks and doing the like, I don't know if you know the like you look
20
like yeah, exactly. I don't do that exactly, but I do try to do that more, because there was a period where I thought I needed a new glasses prescription, because I mean my eyes were like feeling like they were straining, and I got all checked out and they were like, your prescription's the same, but it might be that you're like staring at your computer for 8 hours a day working or whatever, and that has seemed to really help. So I don't know.
Yeah, it's interesting. Okay, now to kind of segue to our topic.
Our actual topic.
Which is health anxiety. And just as a side note, Miss, I think it's okay that it is like a smaller portion, because I feel like I see podcasts that like...
That's fine. No, that's fine.
Okay, yeah. Anyway. Okay, now to transition to our topic of health anxiety. I will say I was actually thinking last night, like I have these new onset headaches. Like I'm never really someone who gets headaches. I've gotten a handful, like, throughout med school, like, less, truly 5 or under, like, they resolve with Tylenol, and I wake up, and I feel fine, and that has not been my experience right now. Like, they've been not more intense, but just longer, not as responsive to medication. I'm still, like, having some symptoms when I wake up in the morning, like, that kind of thing, and much more repetitive, like, almost every day.
Yeah.
And I'm thinking, why don't I think I have a brain tumor? Because I feel like at a different point in my life, I would.
You'd be like,
I'd be looking up, like, maybe. And, you know, a little bit as, like, a medical student, like, I have some things in my brain. I'm like, could this be idiopathic hypertension? Like, intracranial hypertension? Like, I'm just thinking, like, do I have high blood pressure leading to a headache? Like, some of these things, I'm just kind of like, whatever. I feel like I would be having other symptoms as well. And, like, it's interesting that, you know, if I really think about it, I'm like, yeah, maybe you could make an argument, but I'm just kind of like thinking about, and I think you've said this before, like letting the thought come and then just go, like not paying much mind to it. Pass. But I haven't been doing that, like, what's that called? Intentionally. It's just that even though I am anxious for whatever reason, that's been allowed. Like,
it's
my
more
brain,
like a skill that you've developed. And by the way, it's something we do all the time, again, with other thoughts like me, realizing like I need to speak more into the mic, I should maybe say this next. Like, sometimes those thoughts just come and go on their own. You're constantly doing that. It's more just with these kind of more painful, difficult, stressful thoughts that we feel like we have to do something to make the thought go away.
Yeah.
Thoughts just go away on their own if you give it time.
This is true. I will say, like, I'll tell a story that's kind of embarrassing, that I do feel like I anxietied myself too close to the sun. And truly I do feel embarrassed about this, but, like, I know other people experience this too, and just this level of health anxiety. And I think about during COVID, it's like maybe a couple months in, so like very much still lockdown quarantine. I was having heart palpitations, and I don't know if my experience of heart palpitations is what other people describe, because I've heard it more described like, oh, you feel like your heart's racing, or skipping a beat, but people often talk about that like, oh, it's going so fast, it feels like it's skipping a beat. That's not my experience. My experience is like, your heart is beating normally, and then all of a sudden it almost feels like, like, it feels off. Maybe I had like a little like PVC for all my medical people. I don't know. Which is normal and fine, but I convinced, knowing no medical knowledge at this point, I'm like, something's wrong with my heart. And at the same time, I did have like a little bit of POTS symptoms, which is like postural orthostatic tachycardia syndrome, where every time I like stood up, I did have the experience of like feeling dizzy and like at some points like genuinely fainting from that. So I am Googling like heart palpitations, and it's saying, if you're also having dizziness, like go to the doctor. And I'm thinking to myself, oh my God, well, I'm having dizziness. Of course, now I'm thinking about it, like those are unrelated, like experiences. Sure. But as a layperson, I'm reading this and getting so anxious. So what do I do in the middle of the pandemic where you're just supposed to be staying home? I make an appointment with a cardiologist. Yeah, I went all the way to I didn't go to a family doctor. I was like, oh, I'm dying, so let me go to someone who will help me. So I'm there and I'm like, something's wrong with my heart. Okay, turns out I actually do have a murmur. So then they're like, oh my, you do have a murmur, let's like check. Yeah, so now I'm like, I was right. Something is wrong.
Right.
So I'm feeling like both scared and validated. Like a part of me is like, oh yes, I was right. A part of me is now even more anxious because I'm like, oh, I thought it was just anxiety a little bit, but now it's like genuine. So we did the whole workup. We did the Holter monitor, which is like where they monitor your heart rhythm for a while. We did the echo. On the echo, they thought they saw like a little bit of a mitral valve prolapse, which is a pretty benign condition. Depending on the severity, but I think it's estimated that like up to like 20% of people like have a little bit of like a flexible like mitral valve, let's call it, like, because mine was like truly borderline to like even being like classified as that. Like it could just be like a normal variant, right? But then of course, what do I take out of this whole experience of like just feeling even more anxious, like finding these answers or actual things quote wrong just made me feel like now I'm actually gonna die because I have this disease.
Right.
Of course, when you Google
what
it,
more
there's like,
could there be? What like, should I be attending to all my different symptoms all the
there's
time?
an increased risk of sudden cardiac death with mitral valve prolapse, which again is, I'm sure, I haven't looked into it specifically, but it's like gonna be like determined based on severity. I had very mild severity.
Yeah.
So otherwise in very good health. Like I need not put myself in that category. But of course now I'm like, just take me out now. Anyway, yeah. So I kind of feel that whole experience was both like validated my health anxiety in like a negative way, because it showed me, oh, going to the doctors, you will find out that you're right, that something's wrong, when a lot of times your body, it's okay, it might have, like, everyone's gonna have little abnormalities. Like if you look hard enough, everyone is gonna have something, you know, like some people have bunions on their feet. Like, I'm just thinking of, like, little things that, like, some people have deviated symptoms. Some people have, like,
and there's,
I'm just, like, random things that your body...
All these things are generally fine. Like, you're gonna be fine. If you're really experiencing a lot of difficulty and symptoms, absolutely you should go and get those checked out and, like, advocate for yourself. So it's not to say never check on things if you think something's wrong. But something that you've said to me before, which I really resonate, is something to the effect of like, serious things like feel very serious and acute. Like if something is really wrong, it's like really, really a problem. If you're like wondering if something's a problem, it's probably not a big deal. And I think that obviously there's nuance to that, but I think in general,
there is
like
nuance. It's so hard because I think at the same time that I want to tell people to like listen to their heart or listen to their gut, like if they feel something's wrong, I also want people to be mindful that like if you're constantly scanning your body or feeling like something might be off, you will find, and there might be something a little off. And of course, like go talk to your doctor, like that can be the first step. But I would almost liken it to, you know how sometimes you're worried that you're getting sick and you might feel like, does my throat hurt? I don't know. Maybe it feels a little scratchy. I don't know.
Right.
You drink some water and it goes away. And you're like, oh, I guess it's fine. But then you wake up in the morning and you genuinely have that sore throat feeling, and you take your drink of water. There's no doubt in your mind. You're like, I am sick. There's no doubt. You take the drink of water. You still feel like oh yeah, my throat hurts. This is coming. Like,
exactly.
there's times in your life where you're like, do I have this thing? I don't know. You're anxious about it. But most of the time, when there's something actually wrong, you're like, oh no, I know. Like, I am certain this is
something is wrong.
Something is wrong.
100%.
Now, that's not to say people can't experience very real symptoms. Like, so on the other end of, like, I dealt with throughout medical school and somewhat still now, but very much less, just like these stomach pains that were very real. Like,
yeah,
I definitely have IBS. There were times where I literally, like, not a lot, but there were times where I literally could not get off the couch. I was like, ow, like, in a lot of pain. And again, convinced myself that I did have something, like some kind of celiac disease, something going on. And I was telling the doctors, and again, there's so many tests you can do. And I did all of them. And I remember looking at the results, like wanting almost something. I was like, is it gastroparesis? This would fit. I'm like, even like, okay, they did the scan for like if it were like a gallbladder issue. And then of course you're like, as a medical student, I know like, well, it's not always positive. There are times where the imaging is negative and you do have cholecystitis.
Right.
Like, so like, even getting that imaging or getting the test results as negative, it was like I was like Googling things, having even like more knowledge as a medical student. I'm like, well, I can like these key terms. I know this rare disease, like diagnosing myself with like, it could still be like, it was so interesting that even a negative result did not satisfy my anxiety, because it just brought it to the next level of like, okay, if it's not this, then it must be something worse, or am I making this up, or maybe it could still be, but it's a false negative. So like when you are chasing these lab values, and eventually you will get something might pop up, right?
Again, like, I think if you're just, it's similar to when we talked about other anxiety, like when we were talking about OCD and we were talking about checking the stove, right? No one here is telling you that you should never pay attention to if the stove is on or not, right? Of course, you should generally be mindful of turning off the stove when you're done cooking. But it's that same thing of when you're hyper vigilant to it and you need to constantly check, your thought in your mind is like, well, what's the worst that could be? You know, I may as well check, because the other side of it could be something really bad could happen. So let me just check one more time, right? And at first that makes you feel better. But then you get to the point where you're so fixated on checking the stove, you're like, okay, maybe now I need someone else's eyes on it too to confirm the stove is off. Maybe now I need to take a picture of it so I can check later. Like, it grows and grows and grows. Once it becomes anxiety, it's no longer useful to be doing all this checking, because all that does is it's going to make your anxiety grow to the size that you're willing to feed it, essentially.
Yeah.
And it's the same with health anxiety stuff. Obviously, in general, operate about your life and notice stuff happening in your body. But if you become hyper vigilant to stuff in your body, you're gonna maybe, just like there might be a time where you're like, oh shoot, I forgot to turn off the stove. Let me do that. Like, there's going to be a time where you're like, okay, sure. Like, a broken clock is right twice a day, right? There's going to be a time where you're like, actually, there is a minor issue here. Like, you weren't really feeling profound symptoms, but you've happened upon something, you know? Usually in those cases, again, as Allie's saying, they're going to be more minor things. And that might not be, there might not be even a clear treatment for those things. And it might, and again, even if you don't find anything, that's not going to cure your anxiety either, because then you might be like, what else could be wrong? Could it really be something even rarer? Like, once it becomes anxiety and you're checking and you're becoming hyper vigilant, you're only feeding it by doing that checking.
It's interesting because we actually learn as part of like a medical student curriculum, like on my step 2 exam, maybe even my step 1, I don't remember, but it's like next steps, right? If you have a patient that truly like is coming to you with clear health anxiety, all the testing has been negative, like one of the things to do is actually to stop doing any testing, like because we have found that does make it worse. And of course patients will will kind of view the relationship sometimes as like, well, I'm like the client and you're the
Right.
whatever, like just order this for me. What's the harm to you? But it's more like, what's the harm to the patient? Is that like, I am seeing this as being more harm than good, like in this situation. You know, I can even think like on the more extreme examples, like we have patients, like especially in acute psychosis, who are coming to us saying, I have like a brain chip implanted in my brain. I need a brain scan. And a part of you would wonder, well, maybe if they do see the brain scan, would that convince them that there's not a brain chip in their head? And the answer is no. Maybe, like, I'm trying to think, like, because, again, psychosis is not logical. They will find an explanation. Again, this is an extreme example. They will find an explanation. Well, the test wasn't right. It, like, very paranoid
Or actually,
feelings.
it's not a brain chip. It's actually maybe in this other area.
It can't be seen. It was gone during the test. Again, that's the extreme version of it. But I think we can take that same narrative of, like, would you as the patient even believe that it's negative? Like, really sit with yourself and think about that. Like, what would it take for you to not be worried about this? Is it really the sensation that's bothering you? Or is it just the worry that it could be something dangerous that's bothering you? And I think a helpful question to think about is, if you found out that whatever you're experiencing is not dangerous, would you even need a treatment?
Yeah.
And for a lot of people, the answer might be no. And for some people, they say, no, my pain is actually so bad and debilitating that even if there was nothing seriously wrong, I would still want some kind of pain control or like something. And I think then it's worth investigating. And again, I'm not telling you to ignore like lumps in your breast or like things that, of course, are like more hot ticket items. Like if you have a new lymph node, like bring that up with your doctor. Again, lymph node is a trigger for people. It's even a trigger for me because some people just have lymph nodes and you convince yourself you have lymphoma, like myself. So like, I understand that, but like bring it up with your doctor and be real and listen to them, like, for the reasons why they're not concerned. And you can advocate for yourself and say, well, why aren't you concerned? What would you be concerned with?
Right.
The kind of like, you can also, I think something else that's helpful for me is like, okay, let it sit for like a week. And like, just tell yourself like, okay, I don't have to act on this right now. Like, I don't need to make the cardiologist appointment right now. I don't need to do something right now. Like, let me just see how I feel in a week. And if I feel okay in a week, like, I'll reassess. It's just like a strategy of like moving forward and not necessarily acting immediately on this anxiety.
Yeah, because I think, so I've had a number of different patients who've had health anxiety because I worked in a family medicine practice, which was like actually a really nice liaison where people would go to their PCP with health anxiety and their PCP would be like, I think this is a larger problem than, like, they don't have any of these things. It's actually maybe just anxiety. That's their main concern. And the challenging thing is when people do act on their symptoms right away, which in some cases may actually be physical symptoms of anxiety. So I've had patients where they're like, I think I'm having a heart problem because their chest feels really tight with anxiety. And it's like the more they worry that actually they're having a heart problem, their chest feels tighter because they become more anxious, right? And the minute they make an appointment or present to the ER or urgent care, their anxiety goes down and they learn this pattern that, oh, like the way to make this feeling go away is to do something about it. It's just like that checking, like make the appointment, present to the ER, urgent care, whatever it is. And their body learns this narrative that that's the way to make the sensations go away. When in fact, in some of these cases, if they are driven or exacerbated by anxiety, then which are very real, by the way. It's not to say that people's symptoms are not real. They're extremely real, and in some cases can feel like very bad physical
Very
pain.
real. I mean, my
But-
tummy issues.
So I'm not saying it's anxiety as being dismissing it at all. To me, that's no, it's a very real feeling, and just the way to treat it is not by the way we would treat a heart attack. It's the going through these motions, which is to sit with what it's like to, like Allie said, not do something right away. And your body may learn, just like with time of like we talked about, like not checking the stove or, you know, whatever else it might be that you're anxious about, that feeling will go away on its own. It's not a dangerous feeling, and no one has ever experienced anxiety forever, constantly. People have people have ongoing anxiety, obviously, but no one in the history of the world has ever experienced a 10 out of 10 just straight for their whole life. Like, that's just never occurred. It will go down at some point, even if it comes back up again, and your body will learn that, oh, like this feeling, I don't need to do something for this feeling to go away. Is kind of a big thing that can come up. And just to note that, again, in some cases, when it's health anxiety, you might be experiencing extremely real physical symptoms. Like, I can speak personally for me. I know I've had anxiety, definitely encompass stomach problems, like majorly, headaches, hives that have been like very real, present, extremely uncomfortable or even painful, awful feelings that are, at least in part, anxiety is contributing to them. And again, doesn't make it any less real. It just helps you understand how to go about managing those symptoms.
Yeah. I think something that's interesting that I've heard actually neurologists talk about is like, it is normal, and we actually accept in many cases that our emotions can produce physical, can present physically or present with very real things. So for example, if you came to a doctor and said, every time I get sad, my eyes are so watery, something's wrong with me.
Right.
They would say, oh, that's actually like your sadness is causing you to cry. That's actually normal. That doesn't mean that it's not bothersome to you or whatever, but the thing that would actually help your watery eyes is to help that emotion that you're feeling, is to like help you not be so sad, let's say, in this situation. But obviously there's other times where you have watery eyes, and it's because maybe you have an infection or maybe you have something going on. So again, it's not saying that these things are not very real. You can get hives, you can get watery eyes, you can get tummy issues, you can get things that are genuinely real. But it's because our body and minds are like very connected. Our emotions can have very real effects on the way both we process and feel pain in our bodies, and literally have physical, visual manifestations of our anxiety. Again, this is more to just have in the back of your head as you think about symptoms and think about experiences that you have. But of course you can always talk with your doctor. But we would just, again, encourage these thoughts as like a tool to evaluate how your emotions or the situation that you're in might be contributing to the physical symptoms that you have.
Yes, 100%. Yeah, I mean, you could think of a million. I think even the way we attribute things can affect our experience of them, right? So like, I know like a few years ago, I was with someone who was like training for like a half marathon, and we ultimately came to find out that they had like probably just kind of like pulled or irritated some like muscle in their chest. And I was like feeling like some tightness in their chest. But then they started to become anxious. Like, what if this is a heart problem, right? And so it was this real physical, organic, biological thing that had happened. And then this anxiety that had come up for this person that started to make these symptoms 10 times worse, to the point where we were like consulting someone we knew who was a doctor. And we were like, are they dying? Like, should they go to the emergency room right now because their chest feels extremely tight? Do they need an x-ray? What's happening? And literally they just ended up taking Advil. The person was like, maybe just try taking Advil. It sounds like maybe from this run, it could have like just caused some inflammation or a little like irritation. Advil cleared it right up. So like, it's just this idea of where all the time our experience of something or our attribution, I'll throw out one more. Like, sometimes I know when I or others like drink coffee, like your heart starts racing a little more. If I know, oh, I just drank coffee, like I'm not bothered by that. But I've also known times where like, you know, I or someone else hasn't like remembered that like, oh, I just drank coffee, and like something else occurs and we're like so anxious about that. And it's almost like you put all your anxiety on like, this must be so horrible that I like said this thing or did this thing, because my heart is just pounding out of my chest. And like, you attribute these sensations that your body is giving from maybe the coffee to like what happened in your life, and you try to like fix it because you're like, my body's telling me it's awful, it must be awful. And then you realize, oh, I just drank coffee, like maybe let me just give it like an hour. And then you realize, I'm actually feeling a lot better, and maybe I don't need to fix that thing. You know, like there's just all the time, the way that we attribute our physical sensations are so complicated and can actually really color our experience of that thing.
Yeah, I will say, of course, it's such a tightrope to watch when you're experiencing, or to have, to be on, whatever.
Yeah.
When you're experiencing health anxiety, because there is very real experiences of people who are not taken seriously, that things are attributed to anxiety.
Absolutely.
When they're really a true health issue. And this has like very just patients, because especially like who they are, being taken more or less seriously by doctors and healthcare. So like, it's this very tricky line of like, how does one balance when they know, because a lot of people know they have health anxiety, and this feeling of like, well, maybe it is real and I'm just not being taken seriously. Maybe I'm not.
Or what
like,
if this time
what
it's
if
real?
this time like it's real? Like, and so I just want to, again, we don't have like a fix it for this. Like, it's not like, oh, I can tell you one thing, because again, it might be very individualized. Like a person who has more chronic health issues, who, you know, maybe has cancer, like,
yeah,
who is experiencing a new pain, like that might be much more relevant to someone, right, in a very different scenario, who's like a young healthy person.
Yeah.
Like, so this is all contextualized in like your own experiences, but I would encourage you to even be like candid with your doctor when you're bringing up concerns that like, you know, I do have a lot of health anxiety, so that they can help you. And honestly, in my experience, if you're the one bringing up anxiety, I do find that doctors are more willing to not just always chalk it up to anxiety, because they're like, the patient is aware that it's anxiety,
right.
So like, let's consider that as one and let me think about what it could be. So kind of like taking it almost like helps to like take off that shield of, you know, whatever bias of like mental health stuff, and then just to seek therapy.
Yeah. Well, I think
which can
like
be super helpful.
Totally. And honestly, a plug for seeking therapy, and specifically, I think in this case, exposure therapy, or a huge broken record on that, cognitive behavioral therapy, which will really focus on just these processes that we're saying. Think of it almost like a reset. So it'll help you to get to a place where you are at think of yourself as like, I don't know, your scanner is a little bit broken when you have health anxiety. Things are coming up constantly as false positives, and it's impossible to know what's real and what's not. When you go through this treatment, it helps you kind of realign and reset that scanner to a point where, just like most people, you might be more able to, like we were saying, just kind of generally be going out about your life and have a better sense of like, oh, this is coming up, and this actually feels like a very real set of symptoms that needs to get checked out, because you're no longer being hyper vigilant toward things that are like extremely minor. You probably are just going to be more likely to have a really good sense once you go through health anxiety treatment of what is actually worth going to the doctor for. So that's another plug that, though it might seem tough if you do have health anxiety, it might sound like the last thing you want to do to go through exposure or maybe avoid checking things out that feel like you want to check them out. Going through that process will kind of help reset you to a point where you actually will be a much better reporter of what needs to get checked out.
It's a really good point.
So that'll help you have like really good sense of those not so many false positives or negatives, but really accurate.
Yeah. I think just something else to throw out is like, I think your 20s, your 30s, it becomes kind of like the first time in your life. Of course, people get sick all the time, where you actually do start to know people in your life who might have more serious things. Like, you're in your late 20s and all of a sudden, like, someone's diagnosed that you know with breast cancer, who's like a peer. You hear a story about someone your age being diagnosed with colon cancer. You hear about whatever. It kind of is like the first stage of life where you might start experiencing some minor health issues for the first time. Like, just because you're not a kid anymore. And that is the natural progress of life. And I would remind you to just be aware of also how your surroundings might be affecting you. Like, I remember when I had a very close friend die, that came out in manifesting in other ways of health anxiety. So it might not even feel like it's directly related. And it didn't feel like that until someone asked me straight up, do you think that you have cancer because you just had this very bad experience with a friend who didn't have cancer, but who had a very devastating illness. So honestly, that helped me to be a little bit more, what's that? Just rational in the situation of like, I didn't think about how this could be contributing to the situation. So that's just something else that I wanted to throw out there, is just to be aware of like what you're consuming, what you're watching on TikTok, what things are going around. Just like to be curious about how that could be affecting you.
100%. Yeah, I think we've talked about this point too a number of different times on Depressy with other topics, that like we're still so young, and a lot of times we're having experiences for the first or second time. And it can be so tempting to make patterns out of these things, to be like, oh, I'm the kind of person who has these kinds of health issues because I've had this thing and this thing. And to just take some perspective as well, to zoom out and be like, oh, wow, my life is hopefully going to be so long, and things have like happened. You might look back and be like, okay, sure, those are the 2 times this thing has ever happened. Like, yeah, it might become a pattern later, and maybe if it worsens, that's something to get checked out. But like at this point, it might just be random coincidence that this thing has happened to you once or twice. It doesn't mean anything broader about you, that you're the kind of person who X, like when you're still young. And even if you're not in your 20s or 30s, I think to just be mindful of that too, because sometimes we zoom in on the one phase of life we're in to think this is how things are going to be, and that just may not be true.
Yeah. Well, thank you guys so much for watching, for listening. Sorry we've been taking so many breaks, but hopefully next week our audio will also be better.
I know.
I'll go home and get the mic.
Truly, I'm just like, hopefully our health both improves too. I feel like this was on our mind because we've both been falling prey to many illnesses. So hopefully we're both in a place where our health is better. But until then, we will see you next week, and thanks for bearing with us.
Bye, guys.
Bye.